Dark spots, discoloration, post-acne marks, they can be so frustrating. What do you do about it? Make sure you like and subscribe below, and we're gonna get into it right now. I'm Dr. Weinstein. I'm a board-certified dermatologist, and I'm a fellowship-trained cosmetic and laser surgeon. What that means is that after dermatology training, I did an extra year in learning all about cosmetics and lasers. So we did a lot of clinical trials looking at the science behind laser technology and testing it on multiple different conditions and different skin types in order to launch these devices into the world as you see them today. And so I take this part of my practice very seriously and hope to educate you on all the different ways that we can use lasers and all different skin types. So let's get into it and educate you on all the different ways we can use lasers and in-office procedures on all different skin types for different skin conditions. So let's get into it. Today we're going to talk about treating hyperpigmentation and uneven skin tone. The first amazing and super effective procedure we can do in the office are chemical peels. Now, these are highly underrated, and I should note that chemical peels should not be done at home. These are not DIY procedures. I know they can be purchased on Amazon without truly understanding the ingredients and how they work, whether or not they need to be neutralized, and whether or not that specific percentage is safe for your skin. These are all questions that you need to know the answers to in order to safely use chemical peels. And that's why I recommend going to a board-certified dermatologist or esthetician who works with a dermatologist so you can really safely treat your skin with chemical peels. Now, chemical peels are wonderful. There are multiple different types of chemicals that we can use to treat hyperpigmentation, whether it's melasma, acne, post-inflammatory hyperpigmentation. Now, chemical peels are wonderful. There are a number of different varieties. Some of my favorites are salicylic acid peels, glycolic acid peels, Jessner's peels, and trichloroacetic acid peels. Salicylic acid peels are wonderful for active acne. They're also great for melasma, and they're safe in all skin types. So I typically use a 30% salicylic acid peel, and I apply it to the skin whether or not you have active acne or just some dark spots that we want to address. Salicylic acid peels have so many benefits. They're anti-inflammatory, they dissolve sebum or oil in the skin. They also help kill bacteria, and they are keratolytic, which means that they get in there and they chemically exfoliate all those dead skin cells or keratin on the skin. So I especially love them for patients who have active acne and also patients who have post-inflammatory hyperpigmentation from acne scars left behind. They're also particularly helpful for patients with melasma as well. I recommend salicylic acid peels once a month. They can be done as often as every 2 weeks. And after the procedure, it's important to note that you leave the office with a white sort of film on the face. And that is called a pseudofrost that develops when salicylic acid is doing its job. We typically put on a few layers on the skin and then let you go home with that white frost, and then you wash it off a few hours later to get it maximally absorbed into the skin. And then for the next week, you're going to use gentle skincare. After peels or really any sort of procedure, we usually see any sort of healing or change on the skin at about day 3. And so if it's your first time getting a peel, you might notice that your skin starts to be flaky, usually around day 3. Now, if your skin doesn't peel, that doesn't mean it didn't work. That still means the ingredients got into the skin, but it just didn't peel, and that is okay. I get calls all the time saying, I had a peel in the office and it's day 3 and I'm not peeling. That is a-okay. It doesn't mean it didn't work. Other types of peels we can use in the office are glycolic acid peels. These are really great for hyperpigmentation. They're a little tricky. They come in a broad range of percentages, and it's important to choose a percentage that's going to be safe and gentle enough for each different skin, that is going to be safe and gentle enough for that particular patient. So typically I'll start with about 50 to 70% glycolic acid, which I know sounds high, but if you know what you're doing and you know how to use it, they can have really beautiful outcomes and give you a nice refreshed glow after the peel. Trichloroacetic acid peels or TCA peels, I personally like for spot treating. So if you have active acne and then you have a few dark spots on the face, I like to use a 10% TCA to spot treat, and they're also really great for under eye circles and hyperpigmentation. Like I said, with any peel treatment, it's going to take a series of peels to get you to the results that you're looking for. So typically I recommend 1 treatment spaced a month apart for a series of maybe 4 to 6 treatments total. This is also a great way to keep in touch with you and to make sure that your outcomes are as expected and that you're sticking to your skincare routine at home, because everything everything you do at home is going to magnify, augment, and make sure that everything we're doing in the office is reinforced by what we're doing at home, so you can have long-lasting, beautiful results. The next in-office procedure that can help with hyperpigmentation, melasma, very superficial scarring is microneedling. Microneedling is a super popular procedure because it's safe for all skin types. There's no heat that's emitted during the process of microneedling. It's usually a handheld pen with 12 to 32 microneedles attached to the end in a sterile tip. And this device is passed across the skin a few times until we reach the end point of pinpoint bleeding. Microneedling can be used in combination with PRP or platelet-rich plasma, which is a really nice adjunctive treatment to help improve your results and also to help reduce the downtime of microneedling and help to reduce that post-treatment erythema or redness. Now, you might have heard of a vampire facial, which is what Kim Kardashian had done a few years ago, and what that was the combination of microneedling with platelet-rich plasma. This is a procedure that can be done as often as every month, similar to chemical peels, but it's going to help a little bit more with the texture of the skin, and those needles will penetrate the skin a little deeper, so it can help with some scarring and also with pigmentation. Now, in terms of downtime, there's going to be a little more downtime for microneedling because you are penetrating the skin at different depths across the face. And so in some areas, especially if there's more pigment or more scarring, you might have a deeper depth of treatment, which can take maybe 4 to 5 days to heal. I like microneedling for my patients who want something a little more aggressive done than just a chemical peel, but also want low downtime and have some texture addressed as well as that pigmentation. The next treatment we can perform for post-inflammatory hyperpigmentation, melasma, and very superficial acne scarring is the Clear and Brilliant. This is my go-to laser. It's a 1927 nanometer wavelength, which targets water. So the mechanism is that it delivers heat to the skin, heats up the water, and the surrounding environment is also heated. The Clear and Brilliant is one of my go-tos when it comes to melasma, pigment on the skin, and is also safe in all skin tones. It's a 1927 nanometer diode laser. It's amazing for hyperpigmentation, brown spots. It even helps with a little redness on the skin and can be done as often as every month. Often my patients will use this treatment to help reverse something. So whether it's that post-inflammatory hyperpigmentation or uneven skin tone, so they'll have it done once a month for a series of about 4 to 6 treatments. And then we use it as a maintenance laser. So not only does it help with pigment and tone, it also helps with texture and can address those beginning signs of fine lines and wrinkles. So it's a nice laser to consider if you want something to maintain your overall skin. And we do it as often as quarterly as a maintenance treatment. So you can come in the spring, summer, fall, and winter, and we can get your skin glowing no matter what season it is. With Clear and Brilliant, there's really no downtime. It does require a little bit of topical numbing when we start. We usually recommend that you come in 30 minutes prior to the treatment and we apply a topical numbing cream. The treatment feels like a little prickly heat on the skin, so it's not super painful. It's very well tolerated, but that topical numbing cream helps a lot. After the treatment, your face feels like you got a sunburn, but it's very mild and it will wear off in about 40 to 45 minutes. Going home, you want to make sure you put on your sunscreen right away, protect your skin from the sun, especially for about a week after the treatment. Usually by day 2 or 3 after Clear and Brilliant, you'll feel this like gritty sandpaper-like texture on the skin, which is a sign that the treatment is working and was effective. And it's all those dead skin cells rising to the surface, and they'll slough off over the course of a week or so. During this time, we usually recommend that you avoid your active products at home, like your retinol or any sort of acids that you're using. Vitamin C and sunscreen are perfectly acceptable to continue using. The last treatment I like to use for post-inflammatory hyperpigmentation or melasma or dark spots on the skin is something called a picosecond laser. In our office, we have the laser called the Enlighten, and what it does is it fires at a trillionth of a second. So with this super rapid firing, it can break down melanin or superficial pigment in the skin. It can also stimulate collagen production and give you a really nice overall glow. There's no downtime, no numbing required, and this laser can be performed as often as once a month, just like the other procedures we went over. Another treatment I like to use for brown spots on the skin is something called the IPL or the BBL. This stands for Intense Pulse Light or Broadband Light. Now, this is a treatment I wouldn't use in my mixed skin types or my darker skin individuals because it can be unsafe. When used at the wrong settings, it can cause burns on the skin. It's just not a great treatment for darker skin tones. Plus, a lot of people have them. They're very popular in med spas. So if you are of a darker skin tone or mixed ethnicity or you tan really well and someone recommends doing an IPL, I would check their training, but also ask if they had anything else that could potentially work, or find yourself a board certified dermatologist who knows how to properly utilize all of these devices. Now, what the IPL is a broad spectrum of wavelengths. It's not actually a laser. These wavelengths will target both reds and browns on the skin. So it's kind of a twofer when it comes to a device. It's nice for patients who have rosacea and a little bit of sun damage and can deliver a really nice result, especially when repeated a few times. Typically with IPL, you might need 1 to 2 or 2 to 3 treatments to get a great result. I like doing the IPL as a fall cleanup treatment. So after the spring, summer, where you've had a lot of sun exposure and a lot of brown spots have developed on the skin, it's a nice way to kind of clean all that up in the fall and get ready for the holidays. In terms of downtime, there's really no downtime after the IPL. What'll happen is some of those brown spots will become darker, and then over the course of a week, they'll kind of rise to the surface, get flaky, and slough off. It's a really great treatment for patients who want to start something in the category of energy-based devices, but don't want anything that penetrates the skin or causes micro injuries like microneedling or delivers a lot of heat. And so IPL is a great starter treatment. And it's also a really great way to just maintain your overall complexion and tone of the skin. Now, what it doesn't do is anything that has to do with texture. So it's not going to help with scars or fine lines or wrinkling, but we have other things for that. If you like this content and want to know more about lasers or want to really get into the nitty-gritty of how they work and what you should use, make sure you like and subscribe below, and we'll keep talking about how to get your skin glowing.